Good morning. I'm so happy to see you back. Happy Monday. We've got a great and interesting show today for people who have issues with total hip replacement. Total hip replacement is one of the most common surgeries in America. It's being done increasingly. In fact, if you caught Hulu last week, you probably saw that Kris Jenner from the Kardashians had total hip replacement surgery. We're going to unpack why she had it, how to select the right surgeon, and make sure you get the results of a celebrity today on Best Practice Live. Well, if you're anything like me, if you're not anything like me, you've probably seen the Kardashians on Hulu and are aware of Kris Jenner, and all of the things that those young ladies put their mom through over the years. But one thing that she was going through that I don't know that many people realized was hip pain, and hip pain due to osteoarthritis. Now, if you have hip pain due to osteoarthritis, you know it. It's quite severe. It starts in the hip and it radiates into the groin. It's really severe when you walk, in particular when you try to get out of a car, walking downstairs, anything that puts extra pressure on the hip is really enough to do it. Let's start out by looking at the hip joint and why arthritis hurts and why it affects people like Kris Jenner. Let's go to the screen and take a look. This is a drawing, but it's a really accurate drawing of the hip. As most of us realize, the hip is a ball in a socket, and the ball is part of the leg bone, and the socket is part of the pelvis. And here in red, we see the effects of arthritis. When we're young, the ball is covered with just pristine, smooth cartilage, and so for that matter is the socket. But as we age and as a result of imperfections that occur in the joint, defects occur. The problem is the ball is rotating in the socket, and as you might imagine, if something were to happen to that cartilage, let's say a little scratch happened on the very apex of the ball, as it moves in that socket, it's going to put scratches on the socket. And then the scratches on the socket are in turn going to put scratches back on the ball. And there's no end to this, right? Once it starts, we have kind of a snowball cascading effect. And if you have arthritis, you know exactly what I'm talking about. The process just accelerates over time. It's bad enough that there's these physical defects, but what we saw in the picture, did you notice that red around the edges of the joint? That red is inflammation, and it's the inflammation in the bone that drives the pain. That's why we talk so much on the show about anti-inflammatory diets and ways that you can reduce your overall body's inflammation. It's really critical, right, that we control it, because the defect is what's happening in our ball and our socket, but the pain is the inflammation that we feel in the joint itself. So it's really very, very common. In fact, arthritis very often begins in your early to mid 50s and then starts to peak in your mid 60s. The average age of someone in America having arthritis is actually 68. Not having arthritis, the average age of someone having a total hip replacement. Miss Jenner is 66. So she's right at the typical age where this occurs. And she developed the typical symptoms that people do, which is hip pain. We know because she's a Jenner, so her reality TV platform broadcasts it, and she actually went to lunch with Martha Stewart, who herself has apparently had a hip replacement. And like all of us, these two ladies what most ladies their age are experiencing, and that is they're dealing with joints that just aren't living as long as they are, aren't healthy as long as they are, and they start to run out of options. Well, I do want to talk about that because it's a huge, if you watch Hulu and you saw that show, you saw the fear on Kris Jenner's face, and you could hear in her voice the real fear of dealing with hip pain and that pain, the panic that pain causes on our psyche and on our bodies. And it can be paralyzing, and it can cause you to sort of stop. And people turn to their friends. If you're Kris Jenner, your friend might be Martha Stewart. But more often these days, people turn to the internet, and that's what we're here for. We're here to give you the facts that you need to help sort out and make really good decisions about your your body and your treatment. All right, let's take a look, as when we're talking about treatment, at the doctor recommended treatments for hip pain. I just want to remind you of how things are supposed to work. So someone has hip pain, and like Kris Jenner described, that's pain that's over the hip area and then radiates out into the groin. And once it begins, you should go through a red flag survey, and then you should do the routine home care, which is anti-inflammatory medications, rest, ice. The hip joint is accessible, so in those early stages, ice is often a really effective treatment. And for a lot of people, that's going to do it. That's going to be the end of the problem, and you won't have anything further to worry about. But if you reach the 3-week point and you're still having pain, that's when you really want to see your doctor. Your doctor in this capacity could also be a chiropractor. Chiropractors are primary care doctors for the musculoskeletal system, and hip pain is well within their purview. Your doctor's going to examine you. One of the things they're going to do is hold your leg and take the weight off and passively rotate the hip in the socket. If that reproduces the pain, that's a really good sign that the pain is coming from within the hip joint. They're going to take a look at you, take your history, decide, make sure there's not some other factor like a history of cancer, symptoms of infection, or something other rare thing that could be causing it. And then they're going to send you out for an x-ray. And look, that x-ray, everyone complains, oh, the x-ray didn't show anything. But that's what it's supposed to do, is not show anything. But in that 1 in 100 or less people, it's going to show a tumor or signs of a joint infection or something more serious that really needs to be dealt with on an emergent basis. But the majority of the time, you're going to be happily disappointed that the x-ray doesn't show a thing, which is what we hope it does. Now, there's another piece of information on that x-ray that's going to be really important later on, and that's whether or not that x-ray shows that you have arthritis. And it's normal to think of arthritis as kind of a yes or a no, like I have it or I don't. But that's not really the way it works. If you're over 50, you've got some degree of arthritis. And I'm not calling you old, but let's face it, you knew these are not the hips you had when you were a kid, right? These are not 17-year-old you. They're a little stiff sometimes, and if you overuse them, you sort of feel a little hitch in your giddy up, as we say here in Arizona. But it's everyone has some degree of arthritis. And the nice thing about the x-ray is the particle beam goes right through that hip, and we can get an objective sense of, well, is it zero arthritis like when we were kids? Or is it a little bit of arthritis? Yeah, the socket's a little bit narrowed. The ball sits a little more shallow in the socket than it once did, and there might be a little irregularity. Or is it more than that? Are there starting to see bone spurs and significant narrowing, or is it a lot where we're really the ball is all the way down in the socket now, and it's getting pretty close to bone on bone, and we're starting to see significant bone spurs? Or do we actually see severe x-ray of the hip where it is bone on bone and there are big bone spurs? Well, the radiologist who reads your x-ray is going to put a number on that x-ray. And that number could turn out to be crucially important to you getting the right care. So get that report. Hey, you paid for it, right? It was part of the x-ray. So get it and look. And sometimes that's called the Kellgren-Lawrence scale. Sometimes they just say it's arthritis. But you're looking for a number between 0 and 4. And read that report, scour that report, and get that number because we may need it later on. Well, now let's say, I hope you got better. You did your 3 weeks of physical therapy and everything was fine, but let's say you didn't and you're now at 6 weeks. And we're getting to the point where we're at an inflection point and you have to make a decision. And the decision is whether or not you have arthritis or whether or not you could have what's called a labral tear. Now, let me remind you, a labral tear usually results from trauma. The labrum is kind of like a gasket on the pelvic part of this, on the socket, which holds the ball inside. And if you tear your labrum, your hip is just fine until that ball rubs against that tear, and then it hurts so bad you just see stars and want to drop to the ground and faint. So a labral tear is very different from arthritis, where there typically was no recent injury. Could even be that you have a history of inflammatory condition like rheumatoid arthritis. Or you had a gradual onset of pain in that hip. Either way, what you want to do now is go back to that x-ray and see that number, because if your number is a 0 or a 1 or maybe a 2, and you think you have symptoms more like that labral tear, then you need an MRI. You're at 6 weeks, you need to go in for an MRI. Why is that? Because the labrum is a soft tissue, and that soft tissue is not going to show up on the x-ray. The only way you can see soft tissue injuries, like a labral tear, is on MRI. But if your x-ray shows grade 3 or grade 4 arthritis, moderate to severe arthritis, it doesn't matter if you have a labral tear. You don't need an MRI because it's not going to affect what happens to you. If your arthritis is that severe, then the specialist that you need to choose at that point is a joint replacement surgeon. If the MRI shows a labral tear, then the specialist that you need to choose is also an orthopedic surgeon, but not necessarily a joint replacement surgeon. It's an orthopedic surgeon who specializes in arthroscopic labral tear repair of the hip. It's a different thing. They're actually kind of hard to find. Most cities have 1 or 2 people who do most of these kind of operations for the community. We can help you with that if the MRI turns out to show the labral tear. You can get a hold of us by contacting Best Practice through the website on the link below. But let's assume like the vast majority, I don't know the exact percentage, but let's say it's 90+% of people, and you have arthritis. The reason you haven't gotten better after 6 weeks is that you have arthritis. So now you want to pick a joint replacement surgeon, and I'm going to have a lot to say about that here in a second. I mean, a lot to say, as you might imagine. I'm going to have a lot to say about that. But you're going to go to that joint replacement surgeon. They're going to do an injection into your hip, and then you're going to wait 3 more weeks, follow up with the surgeon. If the injection was effective, hallelujah, go on about your business. But if not, we need to start talking about joint replacement surgery. If you get to that 12 weeks and you're still having severe pain that's limiting your life, that's preventing you from doing the things you want to do. And by the way, if you want to see a good example of this, go back and watch that Hulu episode of Kris Jenner talking to Martha Stewart, of all people, because yeah, that's exactly what it's like. You reach a point where people often say to me, well, how do I know if it's bad enough? If you don't know if it's bad enough, then it's not bad enough, right? If you think, oh, I can live with this, it's really just a minor inconvenience, most days are not painful, then you don't need to be having your joint replaced. But if you've reached the point, as Kris Jenner did, as hundreds of thousands of Americans are now every year, if you've reached the point where you realize, yikes, I can't really be me like this. I can't do the thing. I can't be with my grandkids. I can't work my job. I can't travel. I lived my whole life to get to this point, and now I'm nowhere. Hip replacement. It's a no-brainer, and we'll take a look at that, what that actually means a little more as we progress through the show. All right, so was Kris Jenner a candidate for hip replacement surgery? Yeah, she's 66, averages 68. It goes all the way down if you're 55 is where most surgeons start looking seriously. In reality, no one is technically too young for hip replacement surgery. There used to be this legacy notion that, oh, these implants only last 10 years, so we can't do it unless you're within 10 years of gonna die anyway. No, no, not at all. First of all, the total revision rate at 20 years is now less than 10%. I think it's 8.8% in the Australian registry. So if you're 55, we're talking about 75, and it's not over at 75. It's not like the numbers are spiking up. We don't know how long our current technologies are going to last. It's at least, we know that at 20 years, we're looking at under 10%, which means 90+% of us don't have to have are not having revisions. So no one's technically too young. And another legacy thing that gets thrown in here a lot is weight. A lot of people have the legacy idea that, oh, if I'm overweight, I'm going to put so much force on my new hip replacement that prevents me from being a candidate for hip replacement surgery. It's not true. In fact, you get in a catch-22 really quick, right? You get in the situation where I'm overweight, so I'm inactive. My hip hurts, so I'm even more inactive. Guess what? That makes me even more overweight, and you just start, you can't get out of this vicious circle. No, it's really not true. And the Australian registry data support the notion that there really is no absolute weight cutoff for hip replacement surgery. In fact, people of increasing obesity in the Australian registry are not at higher risk of developing early or higher rates of revision. Surprising, but that's a fact of the data. Now, I'm not saying, I've dealt with my weight my whole life, like many of us, like many of you, and it's not good to be fat, right? There's nothing good about it. There's higher risk of developing blood clot. It's harder surgery for the surgeon, et cetera. But it actually statistically does not dramatically increase or increase statistically significantly the risk of having a revision. So you're not too fat, you're not too old. If you're having a lot of pain, you need to talk to a surgeon. And if you get to this 12-week point, then it's something to consider. You say, oh, but I'm more than 12 weeks out. My pain began 2 years ago. That's common. 12 weeks, this is the minimum amount of time. But in fact, most people have been dealing with these problems for longer. And you reach a point where you've just had enough. And you see a show like this one, or you see somebody go through it like Kris Jenner did, and it's time for you to consider it for you. So that's exactly where we're at. Well, okay, so let's say you think you're a candidate for hip replacement surgery, but should you do it? You're at that lunch and Martha Stewart's not your friend, so you got to decide on your own. You got to make a decision on your own. Well, should I go through with it? Well, one thing that I think you should consider is that it has an excellent outcome. It's one thing to say to the doctor, well, doctor, should I have surgery? And, frankly, it's their job to do this surgery. Not that they're not objective and not that they want to make sure you have a good result, but they're biased, right? So you kind of have to make up your mind before you go into that surgeon. Because of course the surgeon's gonna, if the surgeon's there to tell you if you want to have surgery and you cannot, it's unsafe, yeah, they're experts in that. But the surgeon's not there to make up your mind whether or not to have surgery, right? Surgeons aren't salespeople. A surgeon is a doctor. They're there to do their job. You should decide first by doing your due diligence. And honestly, one of the first things I think you should consider is, well, what did other people think? Other people who had surgery, what's their Amazon review, right? There's no, unfortunately, you can't go on Amazon and get a review. So how do you know? Well, in the surgical area, if you think of surgery as an experience or as a product, doctors measure something called patient-reported outcome, PRO. And patient-reported outcome there are many studies and they're widely reported. I'm always talking about that Australian joint replacement registry And the reason is it's the oldest, biggest registry in the world. It's more than 500,000 people, and it's 20 years old, and it's reliably kept and what have you. And in that Australian registry, they started, as patient-reported outcome measures became more prevalent, they started recording them. And sure enough, total hip replacement has, people are either extremely satisfied or very satisfied 90% of the, in 90% of the hip replacement surgeries. You're not going to see a lot of products in the world like that, right? 90% good or excellent outcome. So that's really, really a very high number. Of course, it's still going to be your job to figure out, you want to make sure you're not in that 10% because there's no way out of it. Once, if you're in that 10%, once you have surgery, there's really no, you're in the 10% forever. You get a good, this is like one and done. You only get one chance to have a good first surgery. And so it's very important. You can't coast and rest on your laurels. You can't say, well, works out great 90% of the time, I'll just roll the dice on whatever. No, it's not like that. You have to really, really take a good look at it. And the reason that 90% of the people are satisfied, the reason for that is clear. It's because hip replacement surgery gets rid of hip pain. Let me show you the data that we keep here on our own surgeries here at Phoenix Spine and Joint. We monitor patients as they go through surgery, and in the we send everybody into patient-reported outcome measures, and we look at them before surgery, and then we look at them 6 weeks after, and then 12 weeks after, which is 3 months out. And 82% of our patients at 6 weeks have little or no pain. 90% of our patients at 12 weeks have little or no pain. And the data's not on here, but I'm here to tell you that the reverse is even better. Going into surgery, around 1/3 of our patients report severe pain, meaning the worst pain that you can experience. And when we get to 90 days, the percentage of our patients who in reality, not theoretically, but in reality, are telling us they still have severe pain, 0%, none. Nobody, not a zilch, negative. So this is reliable. The surgery, total hip replacement, the way we do it here at Phoenix Spine and Joint, reliably relieves the severe pain and almost all the pain for 90% of arthritis in the hip. 98% of people having hip replacement surgery do have arthritis. The remaining 2% have a combination of either they were born with a wonky hip, that's called hypoplasia, or they have rheumatoid arthritis, which is another small percentage, or they have a very rare condition called, or they have an infection, which is very rare, or they get some kind of a vasculitis where they actually have the bone die, very rare condition, which happens, but nothing, very, very unlikely that you need to worry about it. All right, well, let's take a look at, so the reason that total hip replacement has 90% success is that it reliably reduces the pain of arthritis in the hip. And so the second thing to consider is what happened. Oh, hold on a second. Yeah, I lost my earpiece. Hold on. There we go. Now I can hear the team. All right. Hey, thank you very much for your questions. We'll take them, but we're going to have to wait till the end. I just want to make sure we get through the rest of the content. But keep them coming, log them, and we'll get to them. We'll get to them in the right time. All right. I want to talk about what you can do to make sure you get into that 90%. Because again, as I mentioned, there's no getting back there. If you're not in that 90% to start with, you only get one chance to get it right the first time, and there's no great bailout here. So what is the number one thing that you can do? And quite frankly, if you don't remember anything I told you today, it's Monday. If you're just rolling out, and it's afternoon for those of you on the East Coast, but if you're just getting going and you're still groggy headed, and you only remember one thing, this is the one thing I need you to think about, the one thing I need you to remember, and that is you need to pick the right surgeon. You need to pick the right surgeon, and it's literally, I'll show you why. The right surgeon is then going to make all the rest of the decisions which affect how you do. And so how do you pick the right surgeon? Well, I mean, you should, honestly, you should think of it like it's a job interview. You should think of it like it's what you're hiring this person to do the job of giving you a new hip. And everything's going to go forward from there. So what are the criteria? How do you interview them? What are you looking for? Well, let me show you. Let's take a look at the monitor. The first issue is, do they do the anterior or lateral approach? And this was actually the first question that we had over the first live chat question we had. What is the best approach? Is it an anterior approach, or is it one of the lateral approaches, which are, there's two of them, they're called direct superior and superpath. Well, let me say, first of all, anterior or lateral approach, or what? What's the approach that we should avoid? And the approach that we should avoid is the posterior approach. The posterior, by the way, these approaches are just directions. Unfortunately, they're in Latin, but they could have just been, we don't want to say, do you want the front hip, the back hip, or the side hip, right? So we're doctors, so we make it sound a little better. The posterior approach is the traditional approach, and you shouldn't have it anymore. There's really no reason to do it. It's a legacy operation. It's done by legacy surgeons who frankly, they learned a long time ago and they don't know any better, and don't have it. But the reason you shouldn't have it is, in order to do the posterior approach, it's the easiest one for the surgeon, but the hardest one for the patient, because the surgeon is just going to go through, they're going to take down significant muscles around the hip, and that muscle, now that it's been removed by the surgeon, isn't there afterwards to stabilize the hip. And since the muscle's gone and can never grow back, can never be restored, you have permanent restrictions with the posterior approach. And your mother's hip replacement surgery, you may remember they told those old ladies, oh, you can't cross your legs, or you can never ride a horse again, you can't do yoga, you can't go on a trampoline, all this kind of stuff. Well, this ain't your mother's hip replacement surgery, right? We want to have no restrictions. And so you want to have either an anterior. The anterior means from the front, the incision's in the groin. Not a single muscle is taken in order to get in. Now, in the anterior approach, they do open the capsule of the joint, and they used to do a dislocation of the hip. And you have to dislocate it to be able to cut the ball off and put on a new one. And some people think that that is the downside of this approach. Some people think that that dislocation makes it weaker. And then there's the lateral approaches, and for those, they put you on your side during surgery. And the lateral approach is the one that is the question asked about superpath. And superpath, the lateral or direct superior, the lateral approaches, they don't take down no muscle, but almost no muscle, and they do avoid that dislocation. Now, when you compare the anterior and the lateral approach, it's definitely like religion for surgeons. Some surgeons do anterior, some surgeons do lateral. There's actually no data in the literature objectively in terms of complications that separates the two. Anterior has a few more dislocations, but it has a few less infections. And lateral has kind of a similar number to posterior of both, but there's no permanent restrictions and the recovery is faster, so it's definitely better with less therapy. So what's interesting though is there is a little bit of a lower overall patient satisfaction rate with the lateral, the superpath approach, than there is with the anterior. I will say that my impression of the surgeons here at Phoenix Spine and Joint, we have surgeons who do both approaches, and I haven't noticed that. I've noticed a lot of very satisfied people with the superpath or direct superior approach. But so long story short is, which is the better approach? It doesn't matter. you should pick the surgeon, as long as they do one of these approaches, you should pick the surgeon not based on that, but based on the other things which are going to be on our list. All right, so let's go to number 2 on the list. And this concerns the facility. Where do this surgeon do their surgeries? Is it in an ambulatory surgery center, or is it in a hospital with a low complication rate, an objectively low complication rate? So the government maintains a website called hospitalcompare.gov. It's done by Medicare, and they have access to all the data. And they actually track complications in hip replacement surgery. And the complications they track are infection, dislocation, death, thankfully extremely rare, as well as readmission to the hospital, and then all the other hospital-related complications like pneumonia, urinary tract infection, etc. So that data is available. Hospitalcompare.gov actually publishes that, and you can go to a highly rated hospital. So if you're thinking about having surgery, go to the website and look up the hospital you're thinking about having surgery in. Alternatively, you can just avoid all that by going to an ambulatory surgery center. ASCs are just lower risk because there's no hospital errors, there's no, people are screened for COVID, there's just none of these other issues in an ASC that there are in a hospital. It's outpatient, so you almost always get a minimally invasive approach, because otherwise you'd have too much pain to leave. And so you really want to go to an ASC or a hospital that is highly rated. How do you know if your surgeon does that? You ask. You call the office and find out, well, where do they do their surgeries? And get the information and check it off this checklist. Third, fellowship trained and specializes in joint reconstruction. This is really an important one. All the people who do these surgeries are orthopedic surgeons, but some orthopedic surgeons do an additional 1 year of training just in what they call adult reconstruction, which is essentially joint replacement. And the reason this is so important is, as I'm gonna show you later, it's critically important that you go to a surgeon who does a high volume of joint replacement surgeries. In fact, there's a learning curve. And I mean, think about it. Do you want to go to if you're looking for a plumber, do you want to go to the plumber that's worked on 3 toilets or the plumber that's worked on 3,000? Right? You want someone with experience who knows what they're doing and does this as a matter of routine. And I mean, surgeons are they're very different than plumbers actually, but they're no different in that sense, in that there's a learning curve, and you really need to make sure you go to someone who's doing a lot. How many joints does the surgeon need to do a year to make sure they're not on this learning curve and that they're actively doing it? Well, the literature is pretty clear that that's at least 100 joints they've done, and quite frankly, over 230 a year. So you want someone who's doing actively 230 a year, who's got at least an experience doing 100. That's the kind of person you want. Third, you want someone with high patient satisfaction. And you find out about a surgeon's patient satisfaction by typing their name into Google, right? You Google them, and you can see Health Grades, US News. There's several other regional ones, but you want to make sure you get a sense that this surgeon is highly rated. Why? Because, honestly, those online ratings tend to be more about the office than they do the surgeon, actually. But you really don't want to go to a crap office, right? It's frustrating. If you had your choice of a great surgeon in a great office or a great surgeon in a terrible office, well, I take great surgeon's a great surgeon. I take the great surgeon in the great office because I don't want to have to deal with all the irritation. I'm sick and I'm going through surgery. I don't want to be irritated, right? I want someone who's going to take good care of me, and so you want to go to a good office. Next, you want registry-proven implants. I mean, we see all the time. We talked on best practice just a few weeks ago about a recall of your hip joint. The FDA was recalling and actually taking off the market that Kyocera implant. I mean, you don't want to be an experiment, right? The last thing you ever want to be in medicine is an interesting case. You don't want to be an experiment. So you really, really, really have to use implants that have been used. Does that mean the implant should be used for 20 years? Yeah, it does. We want to go to that registry data and make sure we're getting the exact right thing. And then last, robotic assistant. And this really is quite important. You need a surgeon who uses robotic assistants. There's just too many choices of implants. Remember when they used to do these operations and get the one leg was longer than the other, or the angle that the implant goes in has to be absolutely perfect to be associated with the best result. These are, I mean, this is, you want a surgeon who has a robotic helper, not to take the place of the surgeon, but to assist them in getting these optimal results. And the best, the hip robot that most people use today is the Stryker Mako robot. It's really an outstanding tool, and it does these things. It helps the surgeon select the optimal implants for the size of your hip, and it does a really good job of helping them get the exactly perfect superhuman accuracy in the way they drill and hold the materials to get the right output. All right, the next thing we're going to do is go over your, I'd like to see if we can get that clip up from the internet, from Hulu, and let's go ahead and play that now. Let me pause this, and I'm gonna get this up for you here in just a second. Hang on. We got Kim getting nervous, all kinds of stuff happening. Let me share my screen and get this up for you in a way that's gonna work. Whoop, sorry, technical difficulties. Please stand by. Let's see, maybe PJ's gonna help me. All right, here we go, we're getting there now. All right, here it is. Let's go ahead and watch this. We'll see the, let me get an earpiece so I can hear it too. We'll see what was on, television, and I'll stop and give you my comments. Go. All right, first of all, first thing I want you to notice is that was an ambulatory surgery center. So what we were seeing was the doctor's outpatient center for surgery in Los Angeles. So already we get a star for Kris Jenner's surgeon, because that was clearly an ambulatory surgery center. Let's see what else goes on. All right, let's play the rest. Nervous. All right, here we're in the operating room. He's drilling out the hip. There's the Mako robot. So we're definitely got Mako. I mean, when I see them pounding like this, it kind of reminds me of sausage. It tastes delicious, but you never want to see it being made. But they're actually doing the operation. And this is a reamer that he's going to use inside the hip to prepare it for the implant. There's Kim and Kanye being nervous. Now they're reaming out. See how the thing on the reamer is the Mako robot. That's what makes it so precise and helps them pick the exact right size. And here we're getting some snacks. Meanwhile, back in the OR, this is Dr. Snibby. He's Jason Snibby, young guy in Los Angeles. We'll take a look at him in just a second. And they're waiting, nervous. I don't know who these people are. They're wearing masks. Here they're picking the exact right size cup with the Mako and picking the implants, and that's the end of the video. So again, it's just crucial that you pick the right doctor. And Kris Jenner's doctor was Dr. Snibby. And so did Kris Jenner pick well? Is this a 5-star surgeon? Well, we see some really cool stuff. First of all, I can tell you, we called Dr. Snibby's office and checked with his staff. He is fellowship trained in joint replacement. In fact, he went to the Kerlan Jobe Clinic for his training after his residency, which is a really outstanding fellowship experience. So he gets that star. Outpatient Surgery Center. He is fellowship trained. He's in the right physical setting. We saw the Mako, so he has a robotic assistant. We also checked, he uses the direct superior approach. We had that question, superpath, the lateral approaches, superpath and direct superior, are they better than anterior? Well, either way, Snibby's, it does that type of an approach. So we're definitely looking at 4 stars. He uses registry-proven implants. He uses the Stryker Accolade, which is what goes along with the direct superior approach. And so, yeah, that's 5 stars. Good job, Snibby. That's really, really excellent surgeon and really the best chance that you can get to get the perfect outcome. So be like Kris. Pick somebody who's 5 stars and make sure you get the right person. I mean, does it really matter, right? Oh, by the way, does Snibby have good online reviews? Yes, we looked him up. This is a cutout of Dr. Jason Snibby's healthcare rating, and he was a 4.3, which is really quite good. Anything over a 4 is pretty good, and certainly great comparable to the other doctors in the LA area. All right, so he's a 5-star surgeon. You want to go to a 5-star surgeon. Does it really matter? You bet it does. Let me show you the results of a recent paper that was published in the Journal of Arthroplasty. They looked at complications and the odds of having complications with low versus high volume surgeons. And this is, we're going to be, if you're having a knee issue, you're in this right column, but we're today in this total hip replacement column. And the risk of revision was 1.63 for low volume surgeons, which were surgeons in this study who did less than 50 operations a year. What does that mean? That's the odds ratio. That means you were 1.63 times more likely to have a complication if you went to one of these low volume surgeons. That's an enormous odds. Here it's 2.5. That's 2.5. That's not 2.5%. That's 250%. You were 2.5 times more likely to have an infection if you went to a low volume surgeon. I mean, that's terrible. 2.5 times? No way. Dislocation, 2.47. Death, 1.72. Death, people. Well, these, yeah, but nobody goes to these low volume surgeons, right? It's really, there's no, it doesn't matter if their risks are so high if nobody goes. Wrong. It turns out everybody goes to these wrong surgeons. 88% of total knees and 93% of total hips are done by low volume orthopedic surgeons. This isn't in some backward country that no one's ever heard of. This is in the United States of America. 93% of you, 93 out of 100 people watching this video are gonna pick the wrong surgeon. Well, Kris Jenner didn't pick the wrong surgeon. She got a 5-star surgeon. What about you? I'll tell you, so why? Why are so many people going to surgeons that have a 2.5 times higher likelihood of having really serious complications? The reason is misplaced trust. So what happens is you've got a little hip pain. Remember in our algorithm, you saw your doctor, you went to therapy, you got referred to some rando legacy orthopedic surgeon who hardly ever does these operations. But you know what they are doing well? They're getting people into the office because they're not very busy. And so you saw that surgeon, they did an injection, you felt better. You waited 6 months, you had another injection, this one didn't work. And now it's time for surgery, and you don't want to offend your doctor by going to someone else, right? Heck yeah, you do. If that doctor has a 2.5 times higher likelihood, 250% higher likelihood of causing an infection or 1.47 death, and yeah, you do want to go to someone else. You want to go to the person who's going to do the best job for you. You have to rate your surgeon using the checklist that I showed you prior to having surgery. And you say to me, oh, well, Dan, I mean, I don't know what kind of implants they use. I don't understand. I mean, I get it that some approaches are better than others, but I don't really know. I can't really do that. I'll do it for you for free. Just call me. Just contact my office. Click through to the best practice page on my website, phoenixspineandjoint.com, and I will rate your surgeon for you. I am passionate about this because my mother had these. One of the reasons, not the only reason, but certainly one of the main reasons I became a doctor, I grew up in a family with a mother who was having hip replacement surgeries. I've seen the importance of this surgery on your entire lifespan. I feel strongly it has to be done in the best possible way. I want you to get the best care available. And the only way to do that is to go to a 5-star surgeon. Really, the only thing you need to get right in this is pick the right surgeon. Pick the right surgeon, and then they're going to pick the implants. They're going to pick the right facility. They're going to do all the work for you. They're the person you're hiring to do this job. Make sure you hire the right person. You only get one chance to do it right the first time. Well, so good, kudos to Kris Jenner, the momager. She managed her own healthcare picked a 5-star surgeon, Dr. Jason Snibbe. Martha Stewart was right. She needed to have this surgery. She's doing real well. She's almost certainly going to continue to do well. So congratulations to her. And my offer to you still stands. If you're in this category that you need hip replacement surgery, you must rate your surgeon before going forward, no matter how much your friends, cousins, nieces, sister told you they're a good they're the best doctor. They may be, but there's a 93% chance you're going to the wrong person. So click through. Let me do a free rating for you, and we'll take it from there. From Best Practice Live, I'm Dr. Dan Lieberman. Have a great day. If you have a question you would like answered on Best Practice Live, there are 3 ways to ask. Leave a comment on any of our social channels, click the link to our website and complete the submission form, or call us at 602-256-2525. The more information you can give us, the better we can answer your question. So please contact us and we can walk you through uploading your imaging to a secure server. Please like and subscribe to our channel to stay up to date with information about your spine and joint health. Lastly, be sure to check out new episodes every weekday at 10 a.m. Pacific, 1 p.m. Eastern, where we answer all your questions.